are the explanations for the negative effects of the specified habits. 1. Negative effects of consuming too much sugar. Excessive consumption of added sugars has wide-ranging negative impacts on the body. Weight gain and obesity. Sugar-sweetened beverages and high-sugar foods are calorie-dense. Chronic overconsumption leads to excess calorie intake, which is a major contributor to weight gain and obesity. Increased risk of chronic diseases. High sugar intake, particularly fructose, is linked to insulin resistance, a key factor in the development of type 2 diabetes. It also increases the risk of cardiovascular disease through high blood pressure and high triglycerides, non-alcoholic fatty liver disease, NAFLD, and even some cancers. Cognitive decline and mood changes. Fluctuations in blood sugar levels can negatively affect mood and energy, leading to sugar crashes and fatigue. Furthermore, diets high in added sugar are associated with cognitive decline and increased risk of depression. Dental problems. Sugar is a primary cause of tooth decay and cavities as it feeds the bacteria in the mouth. Chronic inflammation. Excess sugar contributes to chronic inflammation in the body, which can be a precursor to many chronic health issues and may accelerate skin aging through a process called glycation. 2. Negative effects of eating too many burgers and pizza. Frequently eating fast food items like burgers and pizza, which are typically high in calories, refined carbohydrates, saturated fat, and sodium, can lead to obesity and metabolic syndrome. These foods are high in calories and unhealthy fats, leading to weight gain. Their high content of saturated fats and refined carbohydrates contributes to elevated cholesterol, high blood sugar, and metabolic syndrome. Cardiovascular issues. The high sodium salt content in these foods is a major factor in hypertension. High blood pressure, which damages blood vessels and significantly increases the risk of heart disease and stroke. High intake of saturated and trans fats also raises bad LDL cholesterol. Digestive problems. They are often low in fiber, which is necessary for healthy digestion. A low-fiber diet can lead to constipation and negatively impact the balance of healthy gut bacteria. Blood sugar spikes. The refined carbohydrates in the buns and crusts break down quickly, causing a rapid spike and crash in blood sugar, leading to fatigue and promoting further hunger shortly after the meal. Increased inflammation. High intake of saturated fat in a single meal can increase inflammation throughout the body. 3. Negative effects of eating too many instant noodles. While convenient and inexpensive, frequent consumption of instant noodles, ramen, poses several health risks. High sodium intake. Instant noodles are notoriously high in sodium, often containing more than half the daily recommended limit in a single serving, especially the broth. Excessive sodium intake contributes to high blood pressure, increasing the risk of heart attack, stroke, and gastric cancer. Risk of metabolic syndrome. Studies, particularly in women, show that eating instant noodles 2 or more times a week is associated with a significantly higher risk of developing metabolic syndrome, characterized by high blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels. Nutritional deficiency and high-fat GI. They are made from refined flour, giving them a high glycemic index GI, and are typically low in essential nutrients like protein, fiber, vitamins, and minerals. They are also high in total and saturated fat. Digestive strain. The processed nature of the noodles may stress the digestive tract and hinder the body's ability to absorb nutrients from other foods. Liver stress. The highly processed ingredients, including additives and preservatives, can stress the liver as it works to break them down. 4. Negative effects of using headphones for too long. Using headphones or earbuds for extended periods, especially at high volume, primarily affects hearing and ear health. Permanent hearing loss. This is the most serious and lasting risk. Loud sounds, typically above 85 decibels, directly delivered into the ear canal, damage the tiny hair cells in the inner ear, cochlea. Once these cells are damaged, they do not regenerate, leading to permanent noise-induced hearing loss. Tinnitus. Prolonged exposure to loud sounds can cause tinnitus, a persistent ringing, buzzing, or hissing in the ears, which can be temporary or become a chronic condition affecting sleep and concentration. Ear fatigue and temporary hearing loss. Even at moderate volumes, listening for hours without a break can cause ear fatigue. Loud noise can cause a temporary threshold shift, where sounds seem muffled after removing the headphones. Ear infections. Headphones, particularly earbuds, can trap moisture and heat in the ear canal, creating a warm, moist environment perfect for bacteria and fungal growth, increasing the risk of outer ear infections like otitis externa, swimmer's ear. 5. Negative effects of taking too many headache medications. Overusing or frequently taking acute headache medications, analgesics, can have several severe consequences. Medication overuse headache, MOH, also known as rebound headache. This is a downward spiral where the very medication intended to treat a headache actually causes the headache to become more frequent and severe. It is defined as having headaches 15 or more days a month while overusing acute medications. Organ damage, liver and kidneys. Acetaminophen, paracetamol, is a common ingredient that, when taken at too high a dose or too frequently, can cause severe, life-threatening liver damage or failure. Non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, if overused for a prolonged period, can cause damage to the kidneys, leading to chronic kidney disease, CKD. Gastrointestinal issues, NSAIDs, can irritate the stomach lining, increasing the risk of stomach ulcers, gastritis, and gastrointestinal bleeding. Increased dependency and worsened symptoms. Frequent use can alter pain pathways in the brain, making it more susceptible to pain, and leading to psychological dependency on the medication. 6. Negative effects of not drinking enough water. Failure to drink enough water leads to dehydration, which negatively affects virtually every system in the body. Cognitive and mood impairment. Even mild dehydration can impair brain functions, leading to fatigue, headache, difficulty concentrating, reduced memory, and changes in mood, e.g., increased irritability. Physical performance decline. Dehydration impairs muscle function and electrolyte balance, reducing physical endurance and strength. Digestive and urinary problems. Insufficient water is a common cause of constipation because water helps keep stool soft. It also concentrates urine, making the risk of kidney stones and urinary tract infections, UTIs, higher. Cardiovascular strain. When dehydrated, blood volume decreases, causing the heart to work harder to pump blood, which can lead to a drop in blood pressure and increased heart rate. Chronic dehydration may contribute to long-term cardiovascular problems. Skin and joint issues. Dehydration reduces skin elasticity and moisture, leading to dry, less supple skin. It can also affect the cushioning of joints, as water is a key component of cartilage.